So good morning, everyone. My name's Shazia Khan, and today's learning outcome that we're doing today is learning outcome 2. So we did learning outcome one yesterday, which was to understand how measurement of health and social care provisions inform services. And we looked at elements of, in that learning outcome, of health related data. So we looked at changing patterns of things like mortality, and we looked at infant mortality and morbidity rates, measures of morbidity. We looked at social rate, birth rates, data relating to mental health and mental capacity. We looked at the adult social care outworks framework, which is called ASCOF, and we looked at the social care statistics as well. And we looked at the importance of demography, changes in the population, the size, the age, and we looked at demographic data and why it's so important in resourcing and staffing services as well. We also looked at statistical turn, the mean of the terms mean, median, mode, percentages, and rates. And we looked at reading and interpreting of health, social care relating to statistics, uses and abuse of statistics. So, has anyone got any questions for what we did in learning outcome one yesterday? Nancy?
I wasn't in, sorry.
Oh, okay, so you wasn't in, but it's all recorded, Nancy, for you to have a look at, and will be uploaded onto Moodle for you, okay? So today,
Okay,
all the
thank,
sessions will be uploaded on Moodle for you. So
thank you.
just a refresher again, there's 4 learning outcomes and an assignment discussion session. So today is learning outcome 2. Okay, so that was what we looked at in regards to learning outcome 1. So it was mainly looking at, things like the statistics around it. It was looking at, the mortality rate, the fact that, infant mortality, how much that has increased. And we looked at data, and just going back to it, why is it so important to have data within health and social care profession? What does the data help us with?
To protect the,
But if we have
Is
data on
to
something,
help us to analyze and
yes,
know what
yes, excellent. It
what we
helps us
can
to
do.
analyze and what we need for the future, doesn't it?
Yeah.
If
yeah,
there's any sort of services that are lacking, the quality of service is no good. For example, anyone with dementia, we're not providing a sufficient, or we're not supporting, or we evaluate what's going on. So we evaluate things like maybe the size, the ethnicity. We look at changes in population. We also look at the different percentages, and they help us overall come up with statistics, population. It could be how the analyzing the data, interpreting the data, looking at different groups of people, but also looking at different trends and being aware of any sort of statistics that are, if there's any sort of abuse of statistics as well. We looked at that as well in regards to learning outcome 1. Now we're moving on to learning outcome 2. Can you all see these slides?
yeah.
So the learning outcome 2 is to understand the roles of health and social care practitioners. So just going into that, what are the roles of different healthcare practitioners? What kind of roles are they? Just an example. What kind of roles can you have within health and social care? Is there
Social
diverse?
workers,
Sorry?
like social workers, I think.
Yeah, social workers. And why are social workers needed?
They help to assess and the needs of each person, what they need, and to prevent the risks and like
Yes.
safety and
Yes,
guidance, I
yes,
think.
yes. Social workers, it could be both for adults, Mugera, or it could be for children as well. You have social workers, don't you? And within health and social care, we have a diverse roles of promoting things like well-being of individuals. It could be safeguarding, it could be ethical issues, it could be anything. It might be direct support or indirect support. So the indicative content for learning outcome 2 is to look at the roles and responsibility of various people employed within health and social care setting, to look at partnership work, teamwork, multidisciplinary working, and to look at effective partnership working, importance of communication, identifying, reducing barriers, understanding boundaries. So these are the kind of things that we look at within health and social care. So key terminology when we look at what are healthcare professionals. So a healthcare practitioner is known as a healthcare profession or a healthcare provider. And they are the ones that work in the industry in healthcare, and they are trained to provide any sort of diagnostics, any sort of treatment, and prevent any sort of illness. And do they have to be licensed when we look at a healthcare practitioner? You can't just go in and say, I will provide you a
Yes, they have
diagnostic.
to be
Oh, yes,
licensed.
Yes.
yeah.
You can't do it. I can't do it. We have to be trained. You have to be trained and you have to be licensed to provide medical health and medical advice to patients or anyone, because you have to have this specialized training. It can't just be, you go in and you say, oh, you've got this illness. You can't diagnose that unless you've had training and you're an expert in that. And it's someone who's qualified, a qualified individual, to provide any sort of services to patients. And they work in settings. What kind of settings do they work in? What kind of areas do they work in? Could it be in care homes? Could it
Yeah,
be in
care home,
clinics? Yeah,
Communities, care homes,
yeah,
hospitals
homes,
as
hospitals,
well.
yeah,
hospitals,
private
and
private
GPs.
practices.
Yeah.
Yeah.
And they're there. Their main aim is they are trained to provide a diagnosis, sorry, and provide preventative care. So any care on that diagnosis, and also it could be you doctors, it could be midwives, it could be physiotherapists, it could be occupational health, speech language. Now all these have a specialist area. They have to be trained to that specialist level, because you can't just go in and say, I am a healthcare practitioner and I will give you this advice. No, you have to have a formal training. And we look at that a little bit more because it'll go into areas as such as, how they have to be trained, who they have to be registered with. They have external bodies, professional bodies that you have to be registered with. So number one, understand the roles of healthcare and social care practitioners. So understanding the roles is a crucial part of the healthcare profession. They're there to support patients. They're there to promote well-being and make sure that they require anyone that requires any sort of care, they're there for them and ensure that these, they are, working in different settings. It may, like we said, hospitals, care homes, anything. They are there to diagnose and treat the individual. And like we said, they are there to provide preventative care. What does preventative care mean? What does preventative care mean? So if you've been diagnosed with something, would they put measures in place for you to, get the treatment and things like that?
Yes.
Yes. So if a doctor's diagnosed you with something, Nancy, and they have to provide some sort of care because they've said that you've got this illness, so they have to put measures in place to provide any sort of care for you. Care coordinations together coordinate a plan, and these will be referrals to different organizations. It could be sort of different referrals to different practitioners. So if you've got a pain in your back, it might be referral to the back clinic, or maybe, if you've got anything wrong with your, example, just dermatology, they'll refer you to a dermatologist, for the skin care. They'll put plans in place and care coordination. They'll put them in the right element. Then you've got advocacy, which is it is up to the advocate for the to prevent any sort of, advocate the patient's rights and needs, including what accessibility they have to the health and healthcare social services if they have to be referred. So an advocate would represent that person's interest to ensure that, they're heard in care planning and decision making. And in essence, having health and social care professions is really, really important within any element of any organization. Support practitioners will provide emotional support. What kind of support can they provide if it's emotional support? Give me an example of where someone would provide emotional support, a practitioner.
Counseling.
Counseling, yes. Why would they provide counseling? You're right. But why would they provide it?
Because it helps people to get better when
Yeah.
you get
So could
to
it be an
talk what
example of
is.
someone, for example, could it be an example of someone who's had a car accident and is going through that?
Yeah, that emotional
Yes.
the kind of
Why do they
emotional.
need that support?
For their because they've got trauma.
Yeah, it may be
So
trauma, Mugara, but it may be that they've got some chronic illness after that, condition, maybe they've ended up in a wheelchair or something like that after the accident.
Yeah,
So
go
getting
paralyzed
back to
or
your
lose
life.
their
Sorry,
leg.
what's that, Nancy?
Just say like maybe they get paralyzed or they lose
Yes,
some
yeah,
part of the bodies are not
yeah.
working, and then
And it's very
they
bad
just
because sometimes, that person can't get back to normal life.
yeah,
If they were okay and they've all of a sudden, become paralyzed, like you said, that person to get back to their life is really, really hard for them
yeah. Then they
because,
get like they are not sure again about their life again. They
yes,
start like hating themselves.
yeah.
Uh, yeah,
And especially again, Nancy, looking at the younger generation, if it's someone who's quite young, they're going to think, oh my God, my life has come to an end now in a way because I
yeah,
can't do certain things.
yeah,
So
yeah,
having emotional support and having some sort of counseling and guidance and trying to cope with the changes in their life, it happens to everyone. It's, like the changes play a big role in everyone's life. It could be
yeah,
minor changes. It could be, having the fact that diabetes, that could be a change in someone's life.
yeah,
I got told that I have sleep apnea. So, for me, it's a total change in my life. I can't wear that machine on my face all the time.
oh dear, yeah,
I don't like wearing it because I feel suffocated because I've got other illnesses. So, it makes you feel, so you need that support, you need that guidance.
yeah,
And it helps you not overcome, but come to terms with everything. So that is really an important part of it. Providing practitioners provide support to their families, their patients. It could be someone's family who's, it might be someone who's got cancer, who's at the last stages. The family, trying to get through to the family as well.
yeah. Because the life has changed. It's not the
Yes,
life you know anymore. So
yeah,
you need somebody who understands the life you're
yes,
going
yeah.
through. Yeah,
Yeah, it's difficult, isn't it, in that kind of situation, how
yeah,
much you talk to an individual or how you talk to an individual. Um, Record keeping is another one. Why is it important to keep treatment plans, care plans? Why is it important to have keep all the records? Why is it
so,
important for you to have all the patient records?
because it will help first in data,
Yes,
and it will even when it comes to evidence when
yeah,
something happened,
yes,
and
yes.
in care which is not written is not been done.
Yes, excellent. Yeah, and also, Mugari, is the fact that we have to keep this for any sort of future care treatment plans. If you have, and the next person, for example, if you're coming on to duty and I've just left, that person needs to know what's going on. So record keeping is really important. So when we look
yeah,
at social care practitioners, they play a crucial role within the well-being and health of the patient or their families or the community. So they're an essential part of it. There's a video there that you can watch on 350 careers. 2.1, so we're looking at explaining the roles and responsibilities of at least two named social care professionals. And, there is a broad element of different professionals, but we're going to be looking at the first one, which is a registered nurse. So as a registered nurse, they are healthcare professionals who provide and coordinate patient care. So they play a crucial part in the day-to-day running of the maybe the ward, and promoting and restoring any sort of health. They're there to coordinate patient care, educate patients and the public on various health conditions, and offer support both to the patients and to the families. And they play a diverse role within hospitals, clinics, even to care homes. And they specialize in adults, children, mental health or learning disabilities. So they have different areas. They assess, patients, they educate patients, they document everything down, they administer and provide direct care to patients, including like things, in wound care or catheters and things like that. And they also work with other professionals. They work with doctors, therapists. They are there and implement care plans. They are there to implement these care plans so they suit the patient. They also maintain patient records and documentation on patient, and they also may supervise other healthcare professionals as well. And in the UK, they have to complete a training, a degree to become a nurse. It's not something that you would just happen overnight, So it's something that you're a registered nurse who has passed the course and who's able to, look after the patient, but also provide assessments for the patient, provide care plans, and administer any sort of medication for that person. You can't just give medication if you are not, registered. Occupational therapist. What does an occupational therapist do? What does an occupational therapist do? Nancy?
To make sure you are fit of if you're coming out from any kind of illnesses,
Yeah.
or yeah,
Making
they
sure
just
that you're able to, help individuals get back to maintaining and performing their life. So if they've fallen they've broken their leg, trying to get them back into life, they help people of all ages with daily tasks due to any sort of disability. It might be due to age, it might be due to any injuries, and they assess a person's ability and work with them to develop strategies and find to improve their activities and try to improve their life. And it may be learning new ways to do things. It may be modifying the environment or using adaptive like equipment. It may be, so they are there to evaluate clients' physical and mental, cognitive, their well-being, and they're based on they customize plans for you to identify and put together to execute a plan and make sure that you stick to that plan. So they are there to look at improving your daily activities. It could be things like dressing, bathing, eating as important tasks, because going back to the accident, a lot of people may not be able to walk again, or dress again or eat properly again. So, they are there to help them, and they put interventions into place and take into account the cognitive elements of it. And the ultimate goal for them is to make you fully independent. You may not be fully independent, but what they're trying to do is help you put this plan together and make sure that you are able to do your daily activities. And their role is really important. It could be they may be putting adaptation in place. What kind of adaptation can they put in place for you? What kind of things can they put in place to adapt everything to your daily life?
the
Nancy,
things
what kind of things can they put in place?
the things you used to do, like if you are like paralyzed or you are coming out from any kind of illnesses,
Yeah,
like you used to go, like maybe you was a teacher or
yeah,
you can't do it again, so
yeah,
they just use help you to get
So
back
the
to.
and even if like Nancy, if you used to shower yourself and you can't do
Yeah,
it
yeah,
yourself, they
yeah,
provide you adaptive maybe chair to sit in the shower, or
yeah,
rails, to help you and support you so that you're able to independently do things yourself. So
yeah,
that's really important. Then we have a social worker, and the social worker, like you said earlier, is responsible for supporting the families, and it could be someone who provides support to individuals. It could be, young people, it could be family, it could be old people that need, and it's there to try and improve their well-being and protect them from any sort of harm as well. And the social workers work, some social workers are specialists just for children, some work with different ages, some work with the elderly, and it's things like, trying to look at specialize in areas such as things like mental health, or working with adults with disabilities as well. And it could be things like developing plans for them in regards to their housing, healthcare, and financial assistance as well, because sometimes people are not able to do that themselves, and especially, you know, elderly people. And they work with, they connect, such as financial assistance, we said, maybe any sort of mental health support they can offer them. And for me, I think their main role is safeguarding and protection. So they are protecting vulnerable individuals, including children, from any sort of harm and abuse. And they build this trusting relationship to put interventions in the and provide them guidance. It's really important for social workers. Do you think the social workers play a big part in the health and social care profession?
yeah, I think so.
Why do you think they play such a big part? They didn't used to historically, because they had their own little, setting, and they didn't really play a big part. But now they're part of the health and social care in regards to some social workers can be at the hospital. Why do you think they play such a big part? Do you think there's a need for supporting the families and, individuals?
Yeah, some people they don't have the families, and
Yes.
then as a social worker they come up and then they be
Yeah.
like their family to guide them
Yes.
and tell them
And
what they
especially if
should
someone,
do.
Nancy, has mental health issues, the
Yeah,
social workers may, look at working in different variety of settings, maybe hospitals, schools, community, government agency. And, they, provide people with assessing clients, providing counseling and support, collaborating with other people. If it's if children, if there's children, they focus on child protection. And if it's like adult social care, anyone with disabilities, again, providing education and resources for them, making sure that their family are aware, making sure
mm,
that, their role, they are doing, helping families and, promoting human rights and social justice. So they'll provide resources, advocacy, navigate any sort of difficulty, and prevent, help them if they're vulnerable. Remember, if people are vulnerable, social workers are there to help them as well. Then we've got general practitioners. Now, general practitioners, what are general practitioners? GPs, we refer to them. That's your family doctor, isn't it? A general practitioner is your family doctor, as we say, and they provide primary health care, and they look at services to individuals and their family, and they look at your medical conditions, diagnose them, and treat them. So they may specialize in different areas such as medicine, cardiology, neurology, and they are there to diagnose them and give them treatment for that. They also offer, preventative care. So they may be offering you vaccination, blood tests, screenings, and also GPs. If you have a chronic illness, a long-term one, they help you, help patients to live well with long-term conditions. They also refer people. What does referral mean? Why would they refer you? Why would your GP refer you? Why
If
would
you
the
need
GP
checkup for further investigation.
further investigation? So it may be something, it may be your hair falling, it may be that you have lack of vitamin D, they may be, or maybe need to get checked by a cardiologist or something. They would refer you and treat you. Some GPs are trained for minor surgical surgeries, and they provide you ongoing treatment all the time, so that they are there to provide you that ongoing treatment, okay, and prescribe medication. Then you have a pharmacist, and they provide a healthcare professional, and they provide dispensing prescriptions, and they provide advice on medication usually, and the side effects of your medication as well. And they play a crucial part within health and social care. They are based sometimes in the hospitals now, more often than before, community pharmacies, and they have general practitioners as well. And pharmacists are there to dispense medicine. They're there to ensure safety of that medicine, making sure you take it properly and there's no side effects of it. They also educate patients, and they, provide you guidance on the dosage and things like that. They will keep records of your patient profiles and prescriptions, and they would manage your medication if you have mental health issues or anything like that. So if it's anyone that's elderly or anything, they will provide you dossier boxes. They will provide you advice on, minor ailments. They will tell you the side effects as well. So, they have a huge responsibility. Then we have the physical therapist. Now, what does a physical therapist do? Remember just reading what it says, physical therapist. What do they do? Nancy, what do you think a physical therapist does?
Uh, it's
They're a physiotherapist, okay? So we refer to them as a physiotherapist.
yeah, like it's just like to make sure you are fit enough to do things like
So again, just use that example of the car accident. If you had to go to a physiotherapist, if you had a car accident, what would they
uh,
help you with? Getting back to,
to your feet, if it's your feet to get it back to walking again, like
yes,
they'll just
yeah.
and
It
advise
could,
you what you should be doing, like
yeah,
exercise or
yeah.
those
So if
things.
someone's been injured in the accident, they could help that person, with injuries, getting back to normality, trying to make sure they improve their movement and their pain. So what they provide things like, providing you with exercises, manual therapy, and making sure that the exercise you do, they will prevent you and reduce the pain. And what they
Yeah,
do is they evaluate your condition at the start, and then identify any sort of movement limitations. So it might be the fact that you can't move your leg. It might be the fact that you've had this car accident, your leg's been in pain, and you can't move your leg. Based on that, they would put a treatment plan in place. Would include things like exercises or heat or electrolytic simulation, things like that. And they would help you improve your flexibility, your balance. You may be falling because you've got pain in your legs. They'll, use techniques such as massaging, um, and they use like ultrasound pain relief to try and improve your day-to-day life and make sure that what you are doing, your movements, they have become better. So they put a plan together, and they make sure they improve your strength, your flexibility, and make sure they put a plan together for you. So everyone has a different plan. Not everyone is the same, okay? So they will be monitoring your progress. So they will check with you if you're doing the exercises at home to improve your mobility and relieve any sort of pain. They will also use different equipment to try to utilize any sort of illnesses and any sort of pain. So ultrasound, hydrotherapy, and also, they also educate families on proper body mechanics, exercise techniques, and they provide guidance on people who've had injury so that they don't have further injury. So, their role is quite a wide role that they do within, the health and social care profession. Um, the next one is activity for you to do at home. So visit this online health and care, this website here, and explore different roles. And there are 350 different NHS roles, and everyone makes a difference. So list and understand 2 practitioners' roles of your choice. So do this for next week for the next learning outcome. So if we just click onto that, right click onto that, you can just get it there. Can you see that?
Yeah.
Explore the roles. So just have a look at that and find 2 careers that you want to look at and have a look at exploring them roles, okay? So back to the slides. Can you see the slides now, activity and homework? No?
Active, yeah.
Right, let me just share it
Yes.
again. Just 1 minute. I'll share it again. It's okay. So can you see them now? Yeah? 2.2, identify
Okay.
the
Okay.
key
Yeah.
features of effective partnership work. So here we're looking at effective partnership work and the key features. And the element of it, when you look at effective partnership goals, there are several key features. The first one being shared goals and values. Here, partners must agree and common objective and a shared vision for the partnership. And they must ensure everyone is working towards the same purpose and contribute effectively. And they must align values and help build a foundation of trust and mutual understanding. Why is it important to have shared goals and values and work together? Why is that so important? Making
Because
sure,
it
sorry,
will, you have to agree to each other
yeah.
so it will
Yeah,
make
it's good to work in
effective.
but you will have the same set of goals at the end, won't you, and your values. So you need to make sure you work together properly. The next one is clear roles and responsibility. Now, everyone needs to have clear roles and responsibility so there's no confusion. It helps everyone know what they're responsible for. And it also, helps streamline any sort of operations and avoid any sort of duplication. It clarifies your role. So, it's really important what your roles and responsibility are so you don't get confused and ensure that you are contributing to that partnership. And another one, which is effective communication, again, a really, really important one for me. Why is communication so important? Why do you think communication is so important?
It's just like sharing the responsibilities,
Yeah.
ideas, and all that.
Yeah, sharing
What?
information, sharing ideas, sharing feedback, regular communication so you're keeping on top of everything, making sure you have effective communication, you're listening. Effective listening is really important. And willingness to share information. Some people don't like sharing information, but it helps build that trust among partners. And effective communication channels should be established and maintained to facilitate any sort of collaboration and problem solving. If you're able to, effectively communicate together, you are able to come up with plans. You are able to come up with any sort of, problems you've got within the partnership, and you are able to be clear on what them problems are and try to come up with a resolution. So, getting honest feedback, sharing ideas, it helps build that trust. Then we've got trust and respect. Another thing that's really, really important within any sort of partnership is partners must trust each other. Yeah, their intentions, their commitment, respect others, perspectives, and contribute to a positive, inclusive environment. And you build this trust over time, but it's essential for any sort of a partnership to work. Then you have joint decision making. So you must work together as an organization and partner and help ensure that everyone's view is, taken on board. Making sure that everyone is listened to, because it's really important that everyone is listened to. And then the element of flexibility and making sure you adapted flexibility to any sort of strategies in place as well, and collaboration, making sure that you are able to collaborate with each other. Commitment and investment, effective partnership working requires a long-term commitment from all partners and resources. So it is about sharing your own goals, but also achieving a shared goal as well, long-term goals. So having that commitment. Why is it so important to have commitment? Mugar, why do you think it's so important to have commitment and investment into a partnership?
Because if you're not committed to something, you won't
Yes.
do it in the right way.
Yes, excellent. If you are not committed to something, you will not do it in the right way, and then you will fall back. So you need to make sure you are committed. The next slide is partnership work in teamwork and multidisciplinary. Okay, so we've got partnership work, which is working encompassing teamwork, working together, and multidisciplinary agencies. So we've got partnership work is really, really important. Why is it so important to work in partnership? Why do you think it's so important to work in partnership? Because you rely on each other.
It
Sorry,
makes job easier
yes, it makes the
for
job
everyone.
easier. You're collaborating with each other. You're collaborating with different organizations. You're building this trust. You're addressing any issues, identifying any barriers, and you're working together, as a team. Teamwork is really, really important. Again, teamwork is you having different skills, you being able to identify your skills, making sure that you have, not everyone has the same skills, do they? So you are responsible to make this team work well. And you have to, in a team, is composed of different people with different skills. Do you all have to have clear roles and responsibilities within a team? Why is it
Yeah.
important to have the clear roles and responsibilities within a team?
Because everyone's supposed to know what they're accountable for
Yes,
and what is their responsibility
yes,
and what is not their
yeah,
responsibility.
yes. Everyone needs to know who's accountable for that, not just one person. Then we have multidisciplinary teams, and these teams consist of professionals from different diverse backgrounds. So it could be nurses, it could be doctors, it could be social therapists, it could be social workers, and they are professionals from different fields who work together to to collaborate and address complex needs for that patient care or patient project implementation. So they are there to collaborate with each other, and they are there to come up with different common goal. They have this common goal. So it could be everyone, pharmacists, physiotherapists, and they bring a diverse area of expertise. So all these have different expertise, which is really good. And they're used to plan and they coordinate and deliver care plans and make decisions together with treatment. Is it good to have diverse expertise in a multidisciplinary teamwork? Is it good
Yes,
to
Yes.
work in?
it is
Yes,
good because
yeah,
it helps what you don't know, another
yes,
person will know. It's
yes.
like to have more specialists together. Uh, yeah.
They have this one shared goal to achieve, but they have different ideas, don't they? They have different skills, and the whole outcome is to achieve the patient outcome, to implement a new service, maybe address any sort of issues, and they work together to collaborate. And people from diverse perspectives of team, they help each other and they integrate knowledge, different types of knowledge, and they can be very comprehensive and tailored care plans put in place. But when they collaborate and work together, they foster this open communication and collaboration between different team members, and improve the coordination of care. And they are in various settings, it may be in mental health, it may be hospitals, but they do work together and they work as a team. They share ideas. They have this, first they have this one outcome at the end of it, but they all work together. Collaboration is really, really important when working in multidisciplinary working. And I think it's really good. I don't know how you feel about it. I think it's really good that people from different areas get together and work together. I don't is that Vida, Nancy, Mugara, do you think it's quite good because they
Yeah.
share ideas and things?
Yes. Yeah. You
Yeah,
got different ideas. You come
yeah,
together and then you just share them. You go.
yeah,
Then you compare the ideas and then
Yeah, it might be something, Nancy, you haven't thought about, but I've thought about, and it might
Yeah,
be something that they can share the ideas because it works well.
yeah,
Effective partnership working, importance of communication, identifying, reducing barriers, understanding barriers and contracting roles and responsibilities relationship between health and social care. So effective partnership working requires several points of components, working together. Big one for me is strong communication. Again, why is it so important to communicate properly? Why do you think that's so important, communication? That's not just in health and social care. It's very important in every aspect of life. Strong communication ensures that,
yeah,
the information is, communicated properly and clearly. And, and if they want to any sort of, ensure that everyone understands their roles and responsibilities. Then you've got identifying and reducing barriers, and the whole point of identifying strong communication is to reduce any sort of differences, cultural differences, any priorities, lack of trust. And when partners work together, they need to address these barriers to ensure that they work together and promote a smoother collaboration, understanding boundaries, making sure that you're clear of your role and responsibility, and ensuring that everyone is working effectively together, and there's a no overlap, and making sure that when you're looking at understanding boundaries, there's no duplication, and everyone everyone's clear and accountable for what they're doing. Contracting partners have a formal agreement in place with the terms, so these ensure that they're all on the same page. And again, roles and responsibilities, looking at the roles and responsibilities are really important. Everyone should know their roles and responsibilities, and they shouldn't move away from the roles and responsibilities, because sometimes people do. And these elements are really effective for working. These are important components for working in the health and social care and delivering, health and social care to individuals and communities. So it's really important to take these several important components into place. This is a table outlining the relationship between health and social care. So the health and social care, health care is focused on diagnosing and treating illnesses, providing medical interventions. It's led by physicians. Example include things like hospitals, and the funding usually comes from health insurance or government programs. Whereas social care is focused on supporting individuals to live outside and provide interventions, and it's led by social workers and care workers. That could be things like nursing homes and things. And funding again is from local authorities or government programs such as social security. And then they have to collaborate and work together, because they have to make sure that they are focused and working together, and there's a link. Their final goal, so focus is on things like integrated and making sure that there's a more holistic and person-centered approach for individuals and resources as well. So these work together to make sure that treatment is provided, they're supporting the individuals, be it in hospital, care homes, anywhere. They're providing social, economic, social well-being, and providing personal care, and making sure that individuals get support from health and social care services. So if someone's suffered from a stroke, example, they'll get medical treatment, and then assistance would be the social care and daily living. So the health care would be the medical treatment, the assistance would be the social care. Okay, so they have to work together, like we said, because it's really about improving the well-being of the individual. So we've finished learning outcome 2 now. These are the references used for the session. And just to give you a summary of what we've done in today's session in learning outcome 2, we've looked at elements of understanding the roles and responsibilities of health and social care practitioners. We looked at the various people. So we looked at nurses, physiotherapists, and we looked at partnership working such as teamwork, multidisciplinary working. We also looked at effective partnerships, so importance of communication, identifying and reducing barriers, understanding boundaries, contracting roles and responsibilities, And we looked at the different roles and identified what roles they do and what their job role is, what they need to do. So we looked at registered nurse, occupational therapist, social worker, and their roles and responsibilities. So we looked at the whole point of Learning Outcome 1. So these are some of the links and the references, and you can right click onto them if you want to have a look at them. And these helped towards completing Learning Outcome 2. There's reference to ebooks and journals on the Moodle for this unit, which is further reading, and there's a link there to resolution.nhs.uk, and it looks at performance advice and information for healthcare practitioners. Has anyone got any questions before we finish Learning Outcome 2? Has any Nancy, Mugari, and Vida, do you have any questions? No? Nancy, have you got any questions about Learning Outcome 2, or Mugari? Or Vida, have you got any questions?
Not really.
No? Okay, if you've not got any questions, and if you later on think of something,
Yeah.
then you could just email learnerwork@ukvarsity.co.uk. And this is looking at submission of the assignment is to be done on learnerwork.co.uk. But we've got 2 more learning outcomes. We've got Learning Outcome 3 and 4, which are next week, and then we've got the assignment discussion.
Yeah.
So if you haven't got any questions, thank you for attending today's session, and I will see you next week in Learning Outcome 3, which is to understand inequalities in health and social care determinants. Okay, so that's the Learning Outcome 3, and everything will be uploaded onto Moodle for you to listen to the recordings if you need to.
Okay, thank you.
Thank you for attending today's session, and I will see you next week. Have a good
All
week.
right, thank you. You
Thank you.
too.
Bye.
Bye.